Yat welcome to Four Directions of Wellness. I'm Roberta Diswood. According to the Justice Department, 1 in 6 women will experience an attempted or completed rape in her life. However, sexual assault does not just include rape. It can be unwanted or inappropriate touching. Here at Northern Navajo Medical Center, there is now a room dedicated to helping victims understand what can be done for them after their assault. With us today is Judy Wolfe, Sexual Assault Care Coordinator at Shiprock Service Unit, to talk about the new Sexual Assault Nurse Examiner Room. Go ahead and tell us about yourself, Judy.
Last month was my 31st year here at Shiprock, and I worked a year in the hospital and about 26 years as a public health nurse, and then the rest of the time I've been as the Sexual Assault Care Coordinator.
Well, thank you for being here with us. What is the reason for this new Sexual Assault Nurse Examiner Room?
Well, that's really a good question, because before, when victims would come in, they would have to go to Farmington for an exam. And so there were some issues with that. If we transported them, we would have to wait until there would be a motor vehicle operator and an ambulance and I believe a nurse to be available to go with the victim to Farmington to sexual assault services. Mm-hmm. And so now, with the room being here in at Northern Navajo Medical Center, it's out of the emergency room, and it's away from the emergency room. It's in a private room that's away from other patients and visitors, so it's a real private area. Mm-hmm. And what's really nice about the room is that it's set up to be less clinical looking. We have pictures on the walls and a comfortable chair for someone to sit in, and that everyone that comes gets a comfort blanket. It's just a little fleece blanket. Mm-hmm. Children, we have teddy bears for them and other toys. The advocate could paint a child's fingernails to distract them during that time. So it's really nice to be able to have the room right here for people. Because also, if someone had their own transportation, we were never quite sure if they wouldn't change their mind about going. Even though they might say they're on their way to Farmington, they could change their mind. And so here, by having it here, we can answer their questions and have them in a more comfortable room right here in Shiprock locally.
Well, that's really good. So when a victim comes in, what is the medical process that they go through here?
Okay, mostly people come in through the emergency room. But if they were at a clinic appointment and disclosed or told their provider that they had been assaulted, the same process would happen. Whether they're in the ER or in the clinic, they would, their vitals would have been taken, their blood pressure, and they'd be checked over for any kind of medical issues that would need to be attended to first. Mm-hmm. And then sexual assault services would be called, and the victim would talk to the nurse on call and kind of try to determine more about what's happened. And then if the victim is wanting an exam, then what happens is the advocate comes, and we have local advocates that have been trained, and they'll come, and then the nurse will come from sexual assault services to do the exam in the private room away from the ER and other clinics.
Well, that's really good, and that's really interesting for people to know. So when they go to the exam room, kind of what are they covering, or what are they doing?
They would receive basically a head-to-toe exam, and there'd be pictures taken of any kind of injury, and they're measured. We have special measuring rulers that would make it more exact, pictures. The victim would be interviewed as to like what happened, and the purpose of really the SANE exam is to provide really victim-focused care, and that the victim isn't telling their story in the ER to a couple different people. You know, once they say that they've been sexually assaulted, nobody is asking them for all the details until the sexual assault nurse examiner comes. And then she really does a really thorough interview, and then a really thorough head-to-toe exam. And it takes a while.
Mm-hmm.
It takes several hours.
And so if somebody talks about their assault and maybe they were raped, are there any sort of things that are taken care of medically for them?
Yes. Unlike other times, if you think you've been exposed to, let's say, a sexually transmitted disease, we usually like do labs and send them off. But this way we just treat and not wait for positive or negative results. And also, if the person may feel that they could have been exposed to HIV, or they have any fear of pregnancy, we have different medications and can provide more information and counseling for that person.
So the medications that are given to the victim, do they help like prevent the HIV or pregnancy? How does it help the victim?
Okay, and again, the victim always has the choice. You know, they can refuse. They don't have to have any medications if they don't want. We really encourage it, though. Like for sexually transmitted infection, the medications will treat any potential STIs. HIV, if the patient is concerned about that, there's a regimen that they would take right away to treat that. And also, if they're concerned about pregnancy, we also have that available for the victim.
Now that, you know, they're getting all this medication and everything, it really sounds like things are all kind of done here at the hospital for them.
Yes, and that's a real advantage of having the sexual assault nurse examiner room here, because you can get your medications all here, what you need. We have lab, x-ray if that were needed. And also we can make referrals to ENA counseling, medical social work. So it is kind of like a one-stop shop where we can take care of people here and try to also hook them up with some services that they might need after the exam.
Thank you, Judy, for all that information, and thank you for being here today.
Oh, you're welcome.
This has been 4 Directions of Wellness, Hagonet.